Jayden Daniels left today's game against the Cowboys with a really strange looking mechanism for a hamstring injury, and in this video we'll take a look at the play, see if we can get some better details about how exactly this might have happened and what exactly his injury is. Welcome back everybody, I'm Dr. Brian Sutterer, and the goal in this channel is to teach you more about the medical side of the sports world. So let's take a look at Jayden Daniels and what the team has called a hamstring injury. So we'll talk about our hamstring anatomy. I think this picture really says a lot. This can help tell us what muscles we're worried about. This can help give us clues about what potential injuries we're dealing with as we look at our mechanisms. Here we can see Daniels, of course, walking off the field, is grabbing at the back, specifically the back outer portion of his posterior thigh. And this is going to be important because there are different hamstring muscles that sit on the lateral, the outer, as well as the medial inner part of the back of the thigh. And him specifically grabbing at this lateral part gives us some additional clues. But again, just seeing this, I would have thought hamstring as well. This was the play where the injury occurred, and this is where things are a little bit bizarre to me. I'll be honest, this does not look like the typical situation where you would see an athlete get a hamstring strain. There are really two different ways that a hamstring strain, or for that matter, any muscle strain, will occur. The more common for a hamstring injury is what's called like a sprinting type of injury, meaning whenever an athlete is running, whenever they go and they extend that leg outwards, they're kicking the knee out into extension, and in order to slow down that extension, heel strike on the ground and then pull their leg through. That's going to cause this eccentric load while the hamstring is lengthening as the knee extends out. That lengthens the hamstring as you straighten the knee. And then as you pull to fire it, it contracts. That's often when a hamstring strain occurs in somebody who is running or sprinting. The other type is just an overstretch. If you take a muscle and you pull the muscle beyond the limits that it's going to withstand, you can tear the muscle. So remember, a strain is a tear. So hamstring tear, hamstring strain, these are synonymous. So when we look through this play, what I'm trying to think to myself is, okay, is there a position where we could see either an overstretch of the muscle, or is there a time where it looks like he's overactivating the muscle? Of course, we're dealing with his right leg. He's got this knee injury on his left side. We're not worried about the left side right now. As he goes back right there, there's probably going to be more quadriceps than anything as he's going down to the ground. He's going to be firing his quadriceps so that his butt just doesn't totally collapse down. The quadricep, of course, more in the front. Probably not as much right there. I suspect it's sort of this position right here as he's kind of twisting and getting up. I think that moment right there is when there was probably some component of maybe some rotational force through the hamstring, as well as when he was trying to just fire the hamstring to stabilize the position of his knee. But I'll be honest, if you're reviewing this and you're saying, man, this didn't look anything like a hamstring injury, I agree. This did not look like our typical hamstring injury. And I think that's important to a certain degree because it makes me a little bit more worried about sort of the endurance of those soft tissues when we see injuries occur to them in kind of unusual ways that typically the muscle should not be as affected. Here, I think what probably occurs is as he's kind of twisting and being pulled up, he's probably pushing his foot into the ground to a degree where he's almost like trying to pull his heel backwards towards the Cowboys player, and so trying to almost cause a little bit of knee flexion where his heel is coming backwards as he's trying to go towards and get this ball. You can see how he kind of hops up there a little bit. So that's the only thing I can think of. The good thing is this doesn't look like an overstretch type of mechanism because the overstretch mechanisms for hamstrings tend to affect a different muscle. They tend to be more likely to affect the tendon as opposed to just the muscle itself. And so I think it's good at least that this was more of a muscle firing hamstring strain as opposed to the overstretch. But I agree. This is definitely kind of a bizarre mechanism, not something you would typically see. If I had not seen him grab at his hamstring and I had just watched this play, I would be worried about, number one, potentially the knee, specifically the meniscus, because as he's going up, he's twisting. The meniscus, the little cartilage pads inside the joint, can tear, of course, whenever you're twisting with axial load through the knee. And that's kind of what he does. As he pushes up, that knee kind of twists and then the foot releases. So I would have been thinking more about meniscus if we just heard knee injury. Of course, right, we're going off the information that the team has said hamstring, though. And we, of course, saw him grabbing at that hamstring. So now let's go to our biodigital anatomy tool here and talk about those different hamstring muscles and why I was saying it's important with where he was grabbing. So we're looking at the posterior compartment of the thigh. Posterior meaning the back half. The hamstring muscles sit in the posterior compartment of the thigh. The quadricep muscles are going to sit in front in the anterior compartment of the thigh. There's 3 hamstring muscles, and so up at the ischial tuberosity where they originate, you actually have 2 real tendons though. You're going to have the semimembranosus tendon, and then the conjoint tendon is going to consist of the biceps femoris and the semitendinosus. You'll often see it labeled as 3 different groups, but when we're looking at like ultrasound scanning it, we'll call it the conjoint tendon where those two are together. And then of course the semimembranosus separately. Semimembranosus and semitendinosus are going to go around to the medial or the inner portion of the knee. So we can see them coming down here to insert. The semitendinosus inserts a little bit more in the front of the knee here at the pes anserine bursa. Semimembranosus on the backside of the tibia with a little expansion that goes around anterior to the front. On the outside of the posterior compartment is in the biceps femoris. The biceps femoris has two muscle heads to it. It's going to have a long head and a short head. The long head is the one that comes off higher up by the ischium, and then the short head is actually going to come partly off of the femur here and then join up to ultimately form the biceps femoris tendon, which goes down and inserts on the fibula bone. So the small little bone on the lower part of the leg that is also up at the knee, the biceps femoris is going to insert on that fibula. So the biceps femoris is the most common muscle when you have a hamstring strain, and it sits on the outside. This sits right in the area where we saw Jayden Daniels grabbing, and so my suspicion is that this is a biceps femoris muscle strain. The stretch type of injuries typically occur to the semimembranosus, in particular up at the tendon origin. Again, didn't look like an overstretch. Think of somebody falling into the splits awkwardly. And again, he wasn't grabbing on the inside. Would be more unusual to have a semitendinosus tear. Within this biceps femoris, there are different degrees of severity though. There's something specifically called this T-junction, where the short head and the long head kind of come together to form this myotendinous junction, where the two muscles are blending together, forming into that tendon that's going to go down to the fibula. Injuries at that area are going to be higher grade. They're going to take longer to recover. Still not going to be a surgical type of injury unless we find that something was like avulsed off of the bone on the insertion, but could absolutely still be a multiple week IR length type of absence. There could still be some mention of, right, we might come out in here like it's a knee injury. Remember, the hamstring inserts down by the knee. And so when you have these injuries, it's always possible that the tendon could tear off of the insertion. That would probably be a surgical injury. Hopefully this is just the muscle. Hopefully this is more in the muscle itself as opposed to that junction, that T-junction of the short head and the long head coming together. I would expect at least week or two. I think this is certainly an injury that could put him on the injured reserve. I think also this depends on how his left knee is feeling. If his left knee has still been bothering him and they have another reason to take more time, we will probably see him go on the injured reserve with this to kind of help with both injuries. Would be surprised if this is season ending, would be surprised if this is surgical, but that's what I suspect is going on based on anatomy, based on looking at the play. So now that we understand our anatomy, let's go back one last time through the play here. Again, we're looking at his right side. As we see Daniels step backwards, you're looking for either an overstretch or an overactivation of the hamstring. My suspicion is that it occurs whenever he is going from this transition of his right foot being stuck into the ground to then trying to kind of push backward, explode backwards to a degree. There's some activation of that heel coming back towards him. So probably right around in this moment was when I suspect that injury would have occurred. We could still hear about something at the knee because remember the hamstring inserts down at the knee, but based on where he was grabbing, my suspicion is biceps femoris strain. That's it for the video, everybody. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.